A very good afternoon, everyone. This is Namrata, your Bagdara Farms Consultant. I'm live with all of you. I hope you all had a lovely time celebrating Holi with your friends and family. The topic for today's live session is hepatic steatosis. Now, you must be thinking, what is this term? Hepatic steatosis is commonly known as fatty liver. Yes, fatty liver is what we commonly address it is, but the actual name for fatty liver, if diagnosed by a doctor clinically, is known as hepatic steatosis, right? It is also known as fatty liver. So let me explain it to you that fatty liver is a condition in which it is a very common condition caused by storage of fat in the liver, right? Now, most people have no symptoms and it doesn't cause any problems for them. But in some cases, this fat can lead to serious liver damage, right? Now, the good news is you can often prevent it, treat it, reverse fatty liver disease. Now, you need to understand that fatty liver issues can be reversed, can be treated with lifestyle changes. Heavy drinking is most likely said to be the cause for or the reason for fatty liver. But over time, too much alcohol leads to a buildup of fat inside your liver cells. Now, this makes it harder for your liver to work. But you can get fatty liver even if you don't take alcohol. That is why fatty liver is, divided into two categories. It is non-alcoholic fatty liver disease and alcoholic fatty liver disease, right? Now, non-alcoholic fatty liver disease is fatty liver issues caused due to other factors other than alcohol consumption. This is also of further two types. First one is simple fatty liver, or you can it means that there you have fat in your liver, but you may not have any kind of inflammation in your liver, or damage to your liver cells. And the other part is non-alcoholic steatohepatitis. Now, this is much more serious than a simple fatty liver. It is also known as NASH, and it means you have inflammation in your liver. Now, you need to understand the most common problem, the biggest of problems is caused by a simple thing known as inflammation. Inflammation is also known as swelling, right? So this inflammation can be caused due to various factors. Now, like I'm talking about hepatic steatosis, right? That is also known as fatty liver. In non-alcoholic, it is caused due to factors other than alcohol, right? So it can be your lifestyle, the things you eat, or other kind of things, the environment in which it is affecting your system. Now, like I said, that is also of simple fatty liver and non-alcoholic steatohepatitis. That is also known as NASH. Then is alcohol-related fatty liver disease. That is alcohol-related, you can say hepatic steatosis. It is preventable, treatable, can be reversed. It usually get better when you stop drinking alcohol. Now, if you keep drinking ALD, that is alcohol-related fatty liver diseases, can cause serious problems. Now, these problems include an enlarged liver, alcoholic hepatitis, alcoholic cirrhosis, high blood pressure in the liver, large amounts of fluid buildup in your belly, bleeding in your body, enlarged spleen, liver failure, which can be fatal in major cases. Now, you need to understand the symptoms of hepatic steatosis or fatty liver are. With ALD and FALD, there are usually no symptoms. Some people may have signs such as tiredness or pain in the upper side of the belly where your liver is. Now, if you have NASH or get cirrhosis, you may have symptoms like a swollen belly, red palms, enlarged blood vessels underneath your skin, larger than normal breasts in men, skin and eyes that appear yellowish due to a condition called jaundice. Now, you need to understand that these kind of symptoms develop, you know, when you have NASH, there is cirrhosis, when there is more infection that is caused in your system. Now, every problem has various causes and risk factors attached to it. The causes and the risk factors of hepatic steatosis are as follows. So, for ALD, that is alcohol-related fatty liver disease, the cause is too much alcohol, right? So, may you even be even more likely to get it if you drink a lot of alcohol, or if you're obese, malnourished, have genes that make you more likely to get it, have chronic viral hepatitis, especially hepatitis C, are an African American or an Hispanic male, if age, the older you are, the more likely it becomes, the more likely it causes fatty liver in your system. Now, the reasons why some people with FLD, that is non-alcoholic fatty liver disease, have simple fatty liver or other gets is unknown. They say that genes may be a reason that NAFLD or NASH is more likely. If you're overweight or obese, your body doesn't respond to insulin as it should. You have high levels of cholesterol, you're older, you have problems of polycystic ovary syndrome, you have sleep apnea, you're malnourished, you're losing weight rapidly, and so on. And like high blood pressure, like I said, high sugar levels, these are all causes and risk factors of fatty liver conditions. There are also less common reasons why you may get NAFLD or NASH. They include medical conditions that affect how your body uses or stores fat, hepatitis C or other infections, fat weight loss. Now, taking certain medicines such as there are different kind of medications for different kind of treatments. These medications are also reasons for somebody having a fatty liver issue. Also, gallbladder removal. Some people who have surgery to remove the gallbladder are more likely to have NAFLD. Now, you need to understand that hepatic steatosis is the technical name which is given to a commonly caused problem known as fatty liver, right? Fatty liver initially would not have symptoms and signs that would show that but somebody who drinks alcohol should surely be careful of the alcoholic, the ALD, alcohol related fatty liver disease conditions. Now, there is, like I said, this condition can be treated, prevented, and reversed, right? So, there are some self care for hepatic steatosis which I'm going to be listing out. Lifestyle changes can be made, like exercise more. Try to give at least 30 minutes, a day or most to your of the week. If you're trying to lose weight, you might find that it helps to exercise more. If you don't already, are exercising regularly, get your doctor's okay first and then start gradually. Be kind to your liver. See, don't do things which will make it harder for you to recover, for you to get treated, or for you to heal faster. Skip alcohol if you can. Take medications and over the counter drugs only as instructed. What happens is we tend to take medication, self medicate ourselves, as a result of which the body becomes resistant to these kind of drugs and in the end have no effects on our system. Get your cholesterol down. It is very important to keep your cholesterol in check. Eat a healthy plant-based diet. Exercise. Take your medication. This will get and keep your cholesterol and the triglyceride levels where they need to be. Also, manage your diabetes. Like I said, these are very important, crucial factors which can help in helping you take care of the problem in a much natural manner without having any kind of side effects on the system and without depending on too much of medication. Also, manage your diabetes. Check your blood sugar levels and take your medication that's prescribed by the doctors. Or if you're on any kind of natural therapy, then try to follow that regime properly. Now, a very common question that is asked by a lot of our customers here at Bagdara Farms is that can you prevent fatty liver disease? And the answer to that is yes. To prevent ALD, that is to prevent ALD or hepatic steatosis, you need to drink in moderation. That's one drink a day for women and men over 65, and up to two drinks for men 65 and younger. Protect yourself from hepatitis C. Now, this viral infection can make you more likely to get cirrhosis if you drink. So, it is very important to maintain. So, if you really want to prevent it, drink in moderation, protect yourself from hepatitis C, because if this infection happens, your body is more likely to get cirrhosis in the later stages. Check before you mix alcohol and your medication. So you need to understand your body is like a temple. You need to take care of it. You need to take charge of it, right? Taking too much medication can sometimes have side effects on your system when taken along with your medication, right? So if you think you have alcohol, related fatty liver disease, or if you have NAFLD, which is non-alcoholic fatty liver disease, then you need to understand what is the cause of it, what is the source of this problem, and then naturally you can not just prevent it but also reverse the problem and the side effects it causes on your system. Now, for NAFLD and NASH, it boils down to making better choices, correct lifestyle decisions for yourself. For example, like I said, it's essential to exercise, It is very important to eat healthy food, a plant-based diet, eat lots of fruits, vegetables, whole grains, the healthy fats which are around there. Stay at a healthy weight. Managing your weight is the most important thing that you can do to help contribute to a healthy living. If your weight is healthy, work to maintain it by choosing a healthy diet and exercising. Now today I'm here to tell you that hepatic steatosis, right, can be treated and prevented, can be reversed, and there is also a natural remedy which can help you do it, and that natural component or is curcumin. Curcumin is a component found in turmeric, and this curcumin has properties anti-inflammatory, most important to bring down inflammation, antioxidant, and numerous other properties, pharmacological abilities, and medicinal properties. Along with it, it also has therapeutic benefits, which can help in reducing inflammation, reducing oxidative damage, and reversing the problem of hepatic steatosis in the most natural manner, right? The product we have here at Bagdara Farms for hepatic steatosis is Alcorid. Alcorid is an organic supplement made out of curcumin. The curcumin percentage in our products is between 11 to 19%. Please understand, the higher the curcumin percentage, its effectiveness on the body increases. It's only then the product is potent enough to be taken for prevention or treatment of any kind of problem, right? For more details regarding Alcorod, you need to visit our website, the link to which is flashing on the screens. It is www.bagdarafarms.com, right? We have the product, our product section. In the our product section, you will find Alcorid. Alcorid is for alcohol-related problems, and in this case, the hepatic steatosis, which is caused due to alcohol consumption. This product is Alcorid. This powder in it, and it is a course for 20 days. You need to drink it twice in the day, morning, evening, either empty stomach or 1 to 2 hours after your meals. This thing has to be boiled, and a tea has to be prepared, which has to be consumed twice in the day, morning, evening, either empty stomach or 1 to 2 hours after your meals. All details are given on our website, which is www.bagdarafarms.com. In the Our Product section, in the first row, you'll find Alcorid. All details on the product is given. Our products are 100% organic, non-GMO, chemical free, pesticides free. It is a 100% vegetarian product, and most importantly, it has a very high curcumin value, and that is the reason it is given for prevention and treatment of hepatic steatosis, or also known as alcoholic fatty liver disease or non-alcoholic fatty liver disease, right? For more information about our products, about Bagdara Farms, all these information is available on our website. Also on the website, if you scroll down, we have a certification section. Now it's very important you go through that as well, so that you see that we show transparency to our customers, that we are certified by USA FDA, FSSAI, and we have lab reports that show that the curcumin percentage in our products is between 11 to 19%, right? We also have a scientific evidence section on the website. The scientific evidence section shows various articles written on the basis of studies, trials, surveys conducted to show how curcumin, the phytochemical found in turmeric, which is in abundant or in high percentage in our products, that how this component can be beneficial in giving you natural therapy for prevention and treatment of various problems. And in today's case, like I'm talking to you about hepatic steatosis, in that case, Alcorid for alcohol related fatty liver disease, and Livterm for non alcoholic related fatty liver disease. If hepatic steatosis is not caused due to alcohol but other factors, then the product recommended is Livterm, and if hepatic steatosis is caused due to alcohol related fatty liver disease, then the product recommended for the same is Alcorid. If you need more information and want to talk to our consultants, want to talk to me one on one, we give free consultation on call, message, and WhatsApp. You can call us on our numbers, which is flashing on the screens. That is 9560254646. I repeat, 9560254646. You can call us, message us, or WhatsApp on this number, and we will be more than happy to address your queries. For more details, you can also follow us on Facebook, Instagram, YouTube, Twitter, LinkedIn as Bagdara Farms. You can write to us your comments there, you can write your queries there, and we will be more than happy to assist you with the same. So with that, I come to the end of this live session. Like I said, anything to everything can be treated, prevented, and reversed, provided you make up your mind that you need to get out of that problem. Eating healthy, exercising regularly, and sleeping well are few of the things which can help you overcome any kind of problem that you have. And most importantly, let go of stress. Talk to us if you have any queries. regarding hepatic steatosis or fatty liver, and we will be more than happy to address the same for you. Thank you so much, everyone. Enjoy your weekend. I'll see you all again soon. Thank you.